Doctors say that the NHS must prepare to use medical advances to prevent disease rather than just treating it.
The Academy of Medical Sciences says that the development of personalised medicine is an opportunity to protect health.
Critics say the emphasis should be on improving lifestyles rather than what they call pill popping. Here's more from our health correspondent Adam Brimlow.
The Academy says scientific advances mean in future there'll be more opportunities to intervene with treatment before there are any symptoms. It argues the NHS and society must prepare for this if we want medicine to move from being what it calls a disease-focused process to a health-sustaining one. But it acknowledges this is a great challenge. The issue of preemptive treatment has already raised concerns about people being over-medicated, especially in relation to the use of statins for those at low risk of heart attack and stroke. The Academy says potentially this approach could be developed to prevent dementia and other diseases. It says the NHS must adopt new screening technology to establish who might benefit. But ultimately, it must be the patient who decides if it's right for them.
I think it's unarguable that prevention is better than cure. And if you wait until a patient presents with the signs or symptoms of kidney disease, liver disease, heart disease, very often most of the damage is done and can't actually be recovered. So if it were possible to take steps while still in health to prevent or delay the onset of disease, that seems to make very good sense.
Critics say rather than popping pills, the emphasis must be on encouraging physical activity, a good diet and stop smoking. They say the future of healthcare is a healthier lifestyle and that it should be clear there are no quick fixes. Adam Brimlow, BBC News.
Now, you may have heard in the headlines there, leading doctors say the NHS must make greater use of medical advances to try and prevent diseases rather than just treating them.
The Academy of Medical Sciences says that medicine specifically tailored to individuals could help protect and sustain health in the long term.
Critics, though, have concerns this approach could stop those with lifestyle-driven diseases from changing their bad habits. Among them is Aseem Malhotra, who's a cardiologist from the Heath NHS Foundation Trust. We can speak to him now. Very good morning to you, and thank you for your time this morning. The principle here of preventative medicine presumably is one you are happy with. What are specifically the problems that you see in relation to this notion of how treatment could change?
Good morning, Charlie. Well, the first thing to say, I completely agree that prevention is definitely better than cure, but this is going to happen through lifestyle changes, not through mass pill popping. I mean, the elephant in the room is that prescription drugs are now the third most common cause of death worldwide after heart disease and cancer. For example, we know that about a quarter of hospital admissions in the elderly are because of dangerous drug interactions. If you're elderly and you fall and break a hip, about a quarter of those patients will die. But there's a much bigger problem which is going on between the research interface and what doctors end up prescribing in terms of drugs. So just to put it in perspective, and this is something that we should really be concentrating on, the editor of The Lancet, Richard Horton, a few months ago, actually wrote an editorial where he said up to half of the published literature may simply be untrue. There's a big problem around scientific fraud and research misconduct, and unless we address these issues, Charlie, we're not going to really combat the problem in the NHS, which is increasing demand, which is being driven by lifestyle diseases, and also over-medication.
Well, we spoke to Sir Robert Leckler, who, as you know, is the president of the Academy of Medical Sciences. And he put it in very simple terms, which was that if the technology exists, which it does, albeit quite expensive at the moment, to look at people, what their makeup is and what the risks to them might be in the future, it makes perfect sense to take that information and adopt it, not just in terms of pill popping, but also, he said, in terms of lifestyle. Now, the advances in technology will mean we have a greater read on what are the potential future risks for individuals.
Sure, Charlie, I think you're absolutely right, but the problem is that we need transparency, greater transparency when it comes to all these new technologies. You know, there's been a big problem. We've had an increase in obviously the drugs being prescribed in the NHS in the last few years and even globally, but some of the harsh realities are the fact that 4/5 of new drugs are later found to be copies of old ones. The pharmaceutical industry, you know, have an ethical and legal responsibility to produce profit for their shareholders and not actually give you the best treatment. And these are the issues that need to be tackled, but you're absolutely right, but what we need is more transparency. Now, let me give you one example. So statins have come up. They've been quite controversial in the last few years, and they've been prescribed for almost 3 decades. They've driven a multi-billion-dollar industry. They were initially heralded as a miracle drug, a blockbuster drug for heart disease, and there's no doubt they have a benefit, but that benefit we're now realizing is marginal, and the benefits have been grossly exaggerated and the side effects underplayed. A recent analysis in the BMJ actually looked at the published literature, and I say that with a pinch of salt because there are issues around unpublished literature which may, with many drugs actually show they don't have that much of an effect. But looking at the published literature, they analysed the benefits of statins in people without heart disease would add maybe 3 days to people's lives in terms of life expectancy, and 4 days with people with established heart disease. Now, I'm all for people, taking medications if they think it's going to benefit them, but that information and the decision-making process has to be done transparently, and we don't have that at the moment. This is one of the big issues in healthcare. We need greater transparency, better accountability, more independence when it comes to prescribing drugs, and only then can we get really true, better quality healthcare. And to just give you an example about lifestyle changes, Charlie, the data is actually quite strong when you look at evidence around nutrition. That someone taking a handful of nuts, for example, is going to actually be more protective, reducing the risk of heart attack, stroke, and death than taking any drug and without the side effects. So, give people those options, but give them that information in a transparent way.
Dr. Aseem, it's very interesting hearing you talking there. You are a cardiologist, and hearing you talking about the evidence or lack of evidence or how much we can trust the evidence is quite confusing. And you're a cardiologist. I mean, people sitting at home, we've had this problem before about what should they take on board? What evidence can they take, and what guidance, who do they seek guidance from? It's becoming more and more of an issue, isn't it?
Charlie, you're right. And I think, we have a collective responsibility now. The NHS is in crisis. And we've got to this position because of these issues where we haven't dealt with lifestyle and there's been a lack of transparency over medications. And what we need to do is collectively get together and actually say we need to solve this problem, but it's going to start by looking at the root causes of why these issues are here, and then only then can we move forward. So you're absolutely right, but at the moment there is a lack of transparency in the system, and I would say that pumping more money in without looking at how to improve the quality of care that we have at the moment is not going to add any benefit.
Dr. Malhotra, thank you very much for your time this morning.
Thank you, Charlie.